Let me share my screen. We have Nursing Research Week 4. We will be discussing what is qualitative research. So when we say qualitative research, it is grounded in the belief that reality can never be completely known because it is constructed by each individual. So the beauty of qualitative research is its ability to give us the chance to explore, discover, and uncover a certain phenomenon. And the two sources of information in your evidence-based practice, which are your clinical experience and patient preferences, are addressed by qualitative research, because in EBP, we have three scaffoldings. You have your clinical experience, patient preferences, and research studies. So clinical experience and patient preferences are um, supplied or given by qualitative data. And of course, nursing is a humanistic and holistic approach and based in fundamental elements of care. That is why we need qualitative research. And of course, there are a lot of things or context that or processes that we should know in caring for our patients and dealing with our colleagues. That is why nursing is called humanistic and holistic approach. And qualitative research could help us to dig deeper on this and to finally understand the context that we have or we are into. The purpose of qualitative research is, of course, to understand the meaning. When you say understand the meaning, for you to be able to find out what is the essence of something. So it is more of a constructivist research because you are digging deeper into interpretations, or you are trying to understand these interpretations in a deeper way. And of course, you are able to determine patient needs and preferences, and that is one of the scaffoldings of your evidence-based practice. They will be able to tell you exactly what are their experiences in the clinical area or with your interventions. And of course, it determines the ability and or acceptability of an intervention. So in qualitative research, they could tell you frankly if they accept the intervention, okay, or they implement the intervention, or how much or how is their implementation exactly about that intervention. Okay, we have number 5, address a wide variety of research questions. And of course, you could be able to focus on the needs and responses and experiences of the patient, because quantitative data could be done only, or could be gathered only through the questionnaire, and some of the experiences and responses and the needs of the patients would not be all included in that questionnaire. So that is now the beauty of, or the value of conducting qualitative research. Next, we have here examples of qualitative research. So when you are trying to study how do patients with chronic pulmonary hypertension respond to a lung transplant, and that is a case research method. So when you say a case research method, you are only studying a single case, could be to a single patient, or how do nurses on a neonatal unit respond to medication error causing a death. So it could be one group, okay, it could be a group of nurses, but you are trying to understand their response to medication error that caused death to a patient. So it could be a single phenomenon or context involving one group. Okay? You have here how are nurses portrayed in the media. So it is a content analysis, because you are only studying the contents, or the things that are written about how nurses are portrayed in the media or social media. What are the perceived barriers of for ethnically diverse students in nursing programs? So this one is another content analysis, because you will just after analyzing what has been written about this. What is the nature of moral distress in nurses related to witnessing fetal care in the or fetal care in the clinical or critical care units? So this is phenomenology, but phenomenology could be done. It could be interpretive or descriptive. When we say interpretive, it is more of the Heideggerian, and when we say descriptive, it is more of the Husserlian. So it could be it depends on the choice of the nurse. If the nurse wants to include herself in the analysis of data, and that could be more of interpretive. But if the nurse wants to describe only the context, okay, where the nurses are, it could be done by Husserlian or descriptive qualitative research. Number two, what are the long-term implications for intimacy of couples in which the husband has been treated for prostate cancer? And this is phenomenology because you will be asking the experiences of the couples with regards to prostate cancer. Which cultural issues emerged during a merger between a a for-profit hospital and a not-for-profit hospital. So this is ethnography. Later on, we will study how ethnography is done and what is the culture of the waiting room for the open heart surgery unit. So that is ethnography, okay? Because you are trying to understand a certain culture. Which relationship and interactions affect intimate partner violence. So that could be grounded theory. So grounded theory is a theory that is derived from the findings of the research. And another form could be which relationships and interactions lead to teen pregnancy, and that could be done um, for grounded theory, but also for the lighter form, it could be for phenomenology. Okay, for the comparison of qualitative and quantitative characteristic, when we say the research question for a quantitative version, it's very specific, but for qualitative research, it's general and broad. And of course, we may be having the inductive and deductive reasoning. Okay, it could be a purpose instead of a question. So when you say the purpose is again for uncovering, discovering, or exploring the experiences of an individual. For the design, for the quantitative, it's pre-planned, okay? But in qualitative, it's emergent in the response to data collection. So there are times that your data or the data that you have gathered will not fall into a certain qualitative design or process, and then it could be a content analysis instead of a phenomenology. For sample selection, for quantitative, it's random, but for qualitative, it's purposeful. When we say purposeful, okay, we should be having the inclusion criteria. When we say inclusion criteria, when we say inclusion criteria, what are the characteristic or the information or the criteria that you should be choosing in finding your participants. Okay, when we say exclusion criteria, what could be the possible exclusion? Sometimes in qualitative research, possible exclusions could be, for example, if the person is suffering from a severe post-traumatic stress disorder from the information that they will be giving or sharing to you. So that could be an exclusion criteria. And even those who don't want to participate or tell you about that context, okay, that is a part of the exclusion criteria. Another ones we have here, inclusion and exclusion criteria. For the quantitative version, it may be based on demographic. And of course, in qualitative, it's loosely applied. It is based on how you will be going to choose the participants of the study. It is in your power, actually. For the sample size, of course, for quantitative data, we see the Slovin's formula, okay, that are used by statisticians to compute, okay, for the population or the sample size that could represent the population. And for qualitative research, it could be based on the achievement of saturation. Then later on in the next videos, we will tackle about data saturation, thematic saturation. When we say saturation, okay, we stop the interview after asking several participants, and there's no new things that are emerging or new data will be added or could be added to the analysis of or on the categories. For data collection, it is achieved through measurement and of a quantifiable characteristic. So because we use the questionnaire. And for qualitative research, we do observation, we do interaction, we document. We use the field notes. Okay, we use the field notes. So this one, if we use the field notes, okay, if we use the field notes, then we could be documenting our observation. For instrumentation, for quantitative research, we have the questionnaire, and the questionnaire must be valid and reliable. If it is modified, if it's self-made, it needs to undergo what we call reliability and validity, which would mean it must be seen by a group of experts. Okay, if this questionnaire is really valid or it could answer what is stated in the statement of the problem of your quantitative research. For qualitative research, the researcher is the number one tool. So in your data gathering tool and procedure, okay, you will mention first that the researcher is the main tool in data gathering with observation, field notes, and interview type, right? Or if it will be guided by in unstructured interview, structured interview, or semi-structured interviews. And then we have the analysis of data. Of course, for quantitative design, it is pre-planned and does not begin um, unfit. Okay, all data have been collected. So this one for when we say pre-planned, we know already how to conduct the analysis of data because when we chose the design of the research, okay, what particular quantitative design will be our or what particular quantitative design will be utilized in the research, we know what particular statistical tool or computation will be going to, or what possible, or what is the exact statistical computation is done to answer the SOP. Okay, for the qualitative research, when we say analysis of data, we have what we call as method of data interpretation. Okay, what is again method of data interpretation? When we say method of data interpretation, okay, we have your Golaisi, Van Kaam, Van Manen. You would hear about thematic analysis, George's method of interpretation, Mustakas, and the like. So be careful in choosing your method of data interpretation, okay? Because it must be aligned on the particular research design that you will be using for qualitative research, okay? It must be a follower of Husserlian or a follower of Heideggerian. Next, we have the classification of qualitative research. Actually, we have the phenomenology, ethnography. Before it was a case study, but now it is called as your case research, and you have your content analysis and your grounded theory. So these are the most common qualitative research or classifications of qualitative research that we have. For we start with case research method. As we have mentioned, it is an in-depth study of a single participant or single group. Okay, for example, as an example, a while ago, a group of nurses, okay? Could be a group of nurses, okay, on something or a single intervention, okay? This involves observation, interview, and instrumentation, and of course, your instrument here, the main instrument again is the researcher. Okay, it is useful in studying responses of individuals and small groups related to interventions, health behavior, and perception of illness because you have the ability to focus on that single group or single patient with a case. Okay? And this is only the way where we could understand patients with rare conditions. Okay? For example, you wanted to study a patient with HIV, for example, and the only way for you to get all the possible data is through a case research. And for case research, you have it's very practical because you are only dealing with a single group, okay, with an intervention or with a disease or in a single context or phenomenon. The direct applicability to patient care because you are aware that the patient is suffering from this, and these are the feelings of the patient and experiences of the patient, and you could apply to other patients. But then again, be careful of the word generalizability because not all patients with the same condition could be suffering from the same experiences. And this one, it demonstrates the impact of health and illness on individuals. So for a case study, it is very practical for us to know what really is the impact of health and illness on that individual because again you are just focusing on that person or that group and all the things that you can see could be recorded, and this of course could serve as a pilot study for clinical trials or a starting point of clinical trials. Another one, we have the limitations of case study. We have the possibility of attrition. And of course, again, because we focus to a single individual, it might not be generalizable to other groups of people, and you don't have a control over extraneous variables because you only have one group. Okay. Another one, we have the content analysis. If your qualitative research doesn't fit with any of the designs that we have here, it could be in a form of content analysis. Okay, this is not a specific qualitative research design because sometimes the data that you have is not enough for you to have a complete qualitative research, and this could fall under content analysis. Okay? It could be for studying traditions. Okay, that is for content analysis. The strength of the content analysis, it is not complicated. Okay, it's not complicated to carry out. It's not even so hard to do. Okay, because you have the data, you just have to look on the data again. Extended periods for observation are generally not needed because saturation could be done um, in few interviews or focus groups. When we say focus group, we could be involving 3 to 4 individuals in a group discussion, and then we will be noting all the things that they are trying to forward to us or to narrate to us. It results in identification of general themes that allow the researcher to report and answer questions in straightforward and concise way. Sometimes in content analysis, they might not have or to have the method of data interpretation because again this is not really a qualitative design. But then again, if again the data that you have doesn't fit to any of the designs, then it could be in a form of content analysis. Limitations of the content analysis, it relies on the information recall, and again um, sometimes there are things that we could not recall and that would affect our data, our ability to report, or our ability to write, our ability to not even translate it, our ability to document properly the things that we have observed, and the willingness to talk of the of course the participant. Selection effects may come into play because those individuals who agree to participate in interviews may not be representative of those who are affected. Like, for example, you wanted to know what happened to the patients who suffered from COVID-19 in a certain area, and then there were representatives that are in that area but not really affected with COVID-19 or were not really positive with COVID-19, and that could be misrepresentation of the participants of the content analysis. And then the researcher's bias may affect the interpretation and coding of themes in the data because sometimes they do not use a method of data interpretation. They just go directly to the formation of themes. Another one is phenomenology. And phenomenology, as you always hear it, you when you wanted to articulate the essence of an experience, if you wanted to explore that experience, if you wanted to define how unique individuals respond to circumstances, like for example, how would you feel if, for example, you're a nurse and you're infected with HIV, okay, and you have a concern with the lived experiences of humans in relation to a shared phenomenon, like for example, the students um, in who are attending classes in NCM 111, if you wanted to know or to describe their experiences, and that could be in the form of descriptive research. Again, descriptive research is Husserlian phenomenology. Okay? It's Husserlian phenomenology by Edmund Husserl, and Edmund Husserl is a follower of Heidegger before. Okay, but then again, they became away from each other because of some beliefs, because Heidegger believes in interpretive or Heideggerian phenomenology, which would mean that for you to be able to capture the essence of a phenomenon, you must be involving yourself in the data analysis, or your experiences must be also blended with the data that you have taken from your participants. So when we say descriptive, bear in mind it's Husserlian phenomenology, and when you say interpretive, it's Heideggerian phenomenology. When you say descriptive, you will just describe. When you say interpretive, you are trying to blend your experiences to the data that you have taken from your participants, and that is phenomenology. The strengths of phenomenology, of course, you will know common and uncommon experiences. Again, it's very holistic because you are uncovering, you're discovering, okay? And then, of course, it lends itself well to focus groups. Could be because you're conducting a focus group discussion, and then later on you will yield richer data. And of course, they are straightforward. Okay? Again, for phenomenology, we have method of data interpretation, and then this method of data interpretation will guide us how to do or what to do with the data that we have. And we also have the word reflexivity in phenomenology, and reflexivity in phenomenology is done later after the conduct of the research for you to be able to forward are your experiences, what were your experiences in the conduct of the study, what were the limitations that you have encountered, and what have you done with these limitations. Another is you have limitations of phenomenology, again, because you have a large amounts of data. You must be able to be you should be very good in data reduction. Okay, you must be able in managing your data. You must be able to be very good in managing your data, I should say. And of course, some of the reports may be sensitive. It might be causing post-traumatic stress disorder to some of the participants, and sometimes the participants will just say, "I don't want you to include the things that I have said in your data." And again, that is their right. And for example, if you're asking questions to them and they stop talking or sharing, and it's their right. So it's very difficult to really drawing conclusions from this. And bracketing is done, or it should be what we call as your phenomenological reduction. Okay? Bracketing is when you are aware of your biases about the phenomenon. Like, for example, you're a student, or you are having a research on the lived experiences of nursing students on NCM 111, and you are one of the students in NCM 111, and it's very difficult for you to bracket your experiences or to set aside your experiences because you are also experiencing the same. Okay? So you have to have your bracketing. In other research formats, we have what we call as the researcher's background. In the researcher's background, you are not to include the background of the researcher, that you're a student or what. In researcher's background, it is where you place all your biases. Okay, that is bracketing. Okay, you are aware that before you gather your data, these are your biases, and then later on, when you gather the data and you have found out the similarity or differences of your biases to the results or findings of the study, and that could be reflected in your reflexivity later on. And of course, and the interviews of phenomenology, you should have a very or high level of skill in doing the interview, because if, for example, you will be utilizing the structured interview, if you're utilizing that structured interview and you don't know how to probe, okay, or you don't know to how to help the participant elaborate the experiences, and then later on your data might be limited. And of course, the participants must be able to reflect from their experiences, and sometimes it's stressful. So in qualitative research, maybe in phenomenology, you might need to have a psychologist or a psychiatrist um, that could possibly handle your participants when they're having PTSD to some of the painful events, or if the interview becomes stressful to them, and it's your responsibility as the researcher. And this is included in the or mentioned. It should be mentioned in the data gathering tool and procedure that you are ready with a psychologist or psychiatrist that would handle your patients if there are stressful situations during the interview. Another is you have your ethnography. Actually, the most challenging, I think, design for qualitative research is ethnography, because you are to focus on a certain culture. And when you focus on a certain culture, you have to live with them, you have to observe, you have to be one of them for you to be able to capture what is really in that culture. And you are not just an observer here, but you become a participant of the culture. So when, for example, you go to Africa and you want to find out if the people are really eating mud cookie or drinking their urine, and there might be a need for you to also drink your urine and eat the mud cookie. Okay. Next is for ethnography. Okay. Of course, it provides insight into the way unique groups react to health and illness. For example, if you wanted to study how these people in the far-flung areas um, consider patients on a disease. Like, for example, di ba, sometimes they would just place the patient or they would just bring the patient to a hilot if the patient is coughing, or when the patient is developing rashes, they would just spit on the patient, and then later on the patient will be good. So if you wanted to know about those culture, then you might have to participate in that. And ethnography is a naturalistic inquiry for you to be able to draw conclusions or get conclusions about real life scenarios. Okay, it enables you to define different kinds of cultures, and of course the purposes of the culture of the people. But then again, it is labor intensive and time consuming, because again, some books would say that some researchers will spend their entire professional life just to know about that culture, and you have to achieve rapport. They have to believe in you. You have to develop their trust, because if they will feel that you are an intruder, then later on they may not be acting naturally, and if they may not be acting naturally because of your presence, and you may not be able to get what you want, or you may not be getting the data that should be um, captured from that experiences and from that culture. And of course, again, when you are having the habituation, okay, extended contacts enables habituation or reverting to natural behaviors, as some members of the culture come to disregard the observer's presence and no longer see the researcher as an intruder. So there is what we call habituation also, and that is one of the limitations of ethnography. And I think the most difficult, again, there's also a possibility that you will be immersed with the culture. For example, you go to Africa, you went to Africa to understand if the people are really, or you want to really see the culture of eating the mud cookie or drinking the urine, and um, you might come to a point that you don't want to go away from that, and when you came home to the Philippines, and you will just try to eat the mud cookie or drink your urine, so you might be immersed with that culture, and sometimes it is difficult for you to regain or be back to the culture that you used to be in the Philippines. Okay, the most difficult, I think the highest, okay, um, design in qualitative research is grounded theory. So from this one, let me just explain to you that theory construction and concept analysis in your theoretical foundations in nursing is different from grounded theory, because grounded theory is a theory that is derived from research, and for theoretical foundations in nursing, such as your environmental theory, your Sigmund Freud, your Eric Erikson, those are theory construction, and they only follow certain procedures to do the theory right. For example, they would do a concept analysis to finally have theory construction. But for grounded theory, again, this is done. It is a research first, that is a form of qualitative research, and then later on you will be ending in theory construction. This is the most complex, actually. Okay, form of qualitative research, and you are here to discover patterns or reactions or interactions. Actually, in grounded theory, you will have the purposive sampling and the theoretical sampling. Okay, the theoretical sample will be um, the one that will give you these patterns of reactions and interactions. Okay, so I will not be discussing deeper what is grounded theory, because this is not really intended for um, nursing students like you. But then again, if you wanted to do it, you could do it in your PhD degree, because this is time consuming. Okay, again, you have the strengths, of course. You will be able to test the theory if the theory is applicable to, or it could be, the applicability of the theory could be generalized to other population. And of course, you are able to explore human actions and interactions. Okay, and of course, you will be um, able to do something, or to contribute something for policy recommendation out from the theory, and you will be, of course, making a model. Okay, you will be ending with a model. In grounded theory, it should be a model, or a model that conceptual model. Okay, conceptual model muna. It's not a theoretical model. Okay, for you to be able to test if the model is um, effective or not. But for my grounded theory, I have not tested yet my model. That was 10 years ago. Okay, but you have the limitations, okay, difficult to conduct, and requires a high level of competence on the part of the researcher. Okay, you must know how to do it. You must know how to make the mother and child notes. You must know how to use the software, and they are lengthy. They might involve 40 to 50 to 60 individuals for you to be able to really capture what is intended to be captured in a grounded theory. So we have here the mixed method research. In mixed method research, if qualitative and quantitative designs are not enough for you to be able to have richer or more nuanced understanding of research problem, then mixed method could be done. We have the benefits of mixed method, of course, if it's very comprehensive. It allows triangulation, or your findings in a quantitative data, or a quantitative data could be proven via the qualitative data, and vice versa. And of course, you are be able to be flexible here because you have the ability to choose if what particular type of mixed method you will be using. Okay, in the conduct of the research. When you say convergent parallel design, okay, you have here, you're doing the qualitative and the quantitative data at the same time. Okay, but again, you have to analyze them separately, and after that, you can conclude. So again, this one, when you say convergent parallel, sabay sila. Okay, the qualitative and the quantitative data. When you say embedded, it could be the research design could be secondary to the other. So you might have a larger data for quantitative, and then you will be having a lesser for the qualitative, or vice versa. And you could use embedded design to strengthen or supplement your conclusions from the primary design that you have chosen. Like, for example, you have chosen qualitative, and then you might need some qualitative data to strengthen your findings, and that is embedded. Okay. When you say sequential explanatory design, from the explanatory sequential design or sequential explanatory design, from the word itself, explain. Okay, take note of the word explain, and explain would mean you will be doing the quantitative first before the qualitative ones. Okay, but then again, in choosing mixed method research, you must be able to reason out to your panel member later on why you have chosen explanatory over exploratory over embedded or convergent parallel design. It must be based on your study. Okay, so for explanatory sequential or sequential explanatory design, again, explain, quantitative before the qualitative. Okay. You have here exploratory sequential or sequential exploratory. Again, from the word explore, uncover, discover. Okay, mauuna yung qualitative before the quantitative. Okay, qualitative before the quantitative. Okay, so disadvantages of mixed method, of course, it's labor intensive because you are just doing two research studies, and of course, they might be differing and conflicting results, and it's very challenging for you to interpret this data. And um, it is very difficult to find ways to systematically compare the results. And then this one is putting you to a risk of in the interpretation stage. So when you do a mixed method research, be careful or be mindful that you must be able to reason out why did you choose this particular design, this specific design over the pure quality or pure quantity research methods. Okay, that would be all for this video. And the next video, we will be teaching you how to do your review of related literature, how to start finally with your proposal, and we will do it step by step, design by design. Thank you so much, and